Inflammation. Acute phase response. The acute phase response is a complex, systemic early defense system activated by trauma, infection, stress, neoplasia, and inflammation. Manifestations include fever, drowsiness, and physical inactivity, activation of the pituitary adrenal system, acute phase protein synthesis, anorexia, neutrophilic leukocytosis with the left shift, activation of nonspecific and specific immunity, activation of protein catabolism, especially in skeletal muscles, carbohydrates and even lipids, increased slow wave sleep. Mechanisms include production of cytokines with systemic effects. See the screen. Under the action of cytokines, acute phase proteins are synthesized. The basis of acute phase response is imbalance of cytokines. Cytokines are substances which, in the normal vital activity of an organism, are produced in different cells in physiological concentrations and are responsible for optimal regulation of functions on the cellular and tissue levels. In inflammation, anti-inflammatory and pro-inflammatory cytokines are produced. Pro-inflammatory cytokines include interleukins 1, 6, 8, 12, 17, 18, interferon gamma, tumor necrosis factor alpha and beta, and hematopoiesis factor. Pro-inflammatory cytokines activate differentiation of immunocytes, stimulate synthesis of antibodies, enhance adhesion and chemotaxis of phagocytes. Excessive activity of these cytokines leads to destruction of tissues, enhances alteration, promotes spread of the process, induces fever, acute phase reaction, and systemic inflammatory response syndrome. Anti-inflammatory cytokines include inhibitor of interleukin 1, then interleukin 10, transforming growth factor beta, interferons alpha, beta, and delta. They interrupt development of inflammation after a phlogogen has been eliminated from the body. One of manifestations of acute phase response is synthesis of acute phase proteins. Acute phase proteins may be positive and negative. Negative acute phase proteins decrease in blood in acute phase reaction. Positive acute phase proteins increase in blood. Concentration of some of these proteins increases manifolds. That is why determination of these proteins is used with the diagnostic purpose. The main markers of acute phase reaction are C-reactive protein, serum amyloid P and A. Acute phase proteins perform many functions. They inhibit proteolysis, eliminate foreign materials from an organism, modulate immune response, bind and transport biologically active substances, and so on. Fever. Fever is called febris in Latin and pyrexia in Greek. It is a typical pathological process characterized by increase in the body temperature in a result of restructure of the activity of thermoregulation center by pyrogenic substances. Pyros means heat, genesis, birth. Etiology of fever. Causes of fever are called pyrogens, which can be exogenous and endogenous. Exogenous or primary pyrogens get into the body from the environment. By chemical structure, they are a lipid part of lipopolysaccharide membrane complexes of bacterial membrane. Lipoid A. Endogenous, secondary, and pyrogens are interleukin-1, 6, tumor necrosis factor, gamma interferon, produced in the body by phagocytes. They are true mediators of fever. In the table below, you see characteristics of exopyrogens and endopyrogens. Please study the table. Exogenous pyrogens cannot directly affect the thermoregulatory center, but secondary endogenous pyrogens mediate the effect of exogenous pyrogens. Fever starts after accumulation of endopyrogens in blood. Circulating in the bloodstream, these endopyrogens cross the blood-brain hematoencephalic barrier, reach thermoregulation centers, and act on heat-sensitive neurons of the preoptic region of the anterior hypothalamus. Mechanism of action of endopyrogens. Endopyrogens activate phospholipase A2 enzyme with resultant liberation of arachidonic acid from the phospholipids of neuronal membranes. After that, endopyrogens activate cyclooxygenase enzyme that promotes production of prostaglandin E2. Prostaglandin E2 activates adenylate cyclase with the result of increase in the concentration of cyclic 3.5 AMP in the cytoplasm of neurons. This causes activation of AMP-dependent protein kinases and phosphorylation of protein enzymes, which finally change metabolism of neurons in the thermoregulation center. The key factor in the pathogenesis of fever is alteration of excitability of central hypothalamic thermoreceptors. With the development of fever, the body's thermoregulation system is not upset. It is dynamically reconstructed, activated, and works at a higher functional level. Now let us summarize what was said above. In the picture you see that the first event is ingestion of a gram-negative bacterium by a macrophage. Then the bacterium is degraded in a vacuole, releasing endotoxins that induce the macrophage to produce cytokines, interleukin-1 and tumor necrosis factor alpha. The cytokines are released into the bloodstream by the macrophages, through which they travel to the hypothalamus of the brain. The cytokines induce the hypothalamus to produce prostaglandins, which reset the body's thermostat to a higher temperature, producing fever. In result of restructure of metabolism, excitability of cold-sensitive neurons increases and excitability of heat-sensitive neurons decreases. Thus, the central thermoreceptors start to perceive normal temperature of blood, 37 degrees Celsius, as low temperature. The posterior hypothalamus sends a set of efferent instructions to the periphery, which raise the tone of the sympathetic nervous system. Activation of sympathetic nervous system leads to limitation of heat dissipation and increase of heat production. There are increase in the heart activity, constriction of peripheral vessels, dilatation of vessels in the internal organs, skin becomes pale and cold. contractile and non-contractile thermogenesis are activated. This completes the first stage of fever, stage of temperature rise, or stadium incrementum. The second stage, stage of persistence of high temperature, stadium fastigi, is characterized by thermal balance established at a new higher than normal level. Heat production increases, but heat dissipation also proportionally increases. Peripheral vessels dilate, skin becomes hot and hyperemid, a feeling of heat appears, sweat glands are activated. The final stage of fever is stage of decrease in temperature, stadium decrementum. It is associated with cessation of production of endopyrogens. In the absence of endopyrogens, heat production starts to decline and heat dissipation increases. Sweat glands sharply activate, skin vessels dilate, respiratory rate increases. The body temperature decreases, in most cases gradually, lytic decrease, but in some cases very rapidly, critical drop. The critical drop is sometimes accompanied by disorders in the heart function and by decrease in the arterial blood pressure. Stages of fever. In the picture, you see processes of heat dissipation and heat production in normal organism. We see that these processes are equilibrated, which permits to keep the body temperature at normal level. When fever develops, at first heat dissipation decreases, but heat production increases. Due to this, the body temperature rises. It is the first stage of fever, called stage of incrementum. In the second stage of fever, we see that heat dissipation also rises and reaches the level of heat production. So we see that these two processes are again equilibrated but at a higher level. Due to this, the temperature stays high, and this stage is called stage fastigi. In the third stage of fever, heat dissipation remains high, but heat production decreases to the normal level. This permits the body to decrease the temperature. It is the third stage, called stage of decrementum. A graphic record of temperature is called temperature curve. Let us consider the main types of temperature curves. Intermittent fever. Here, the daily variations in temperature exceed 1 degree Celsius. The morning temperature is normal. The body temperature increases periodically at equal intervals of time and stays for several hours. This curve is characteristic of malaria, cytomegaloviral infection, infectious mononucleosis, and purulent infection, cholangitis. Remitting fever. Here, the body temperature is permanently increased, but the daily variations increase 1 Celsius degree. This temperature is seen in tuberculosis, in purulent diseases, for example, in pelvic abscess, in empyema of the gallbladder, in wound infection, and also in malignant neoplasms. Recurrent fever is characterized by alternation of periods of fever with periods of normal temperature. It occurs in relapsing typhus, malaria. Constant fever is constantly elevated body temperature within the days. The difference between morning and evening temperature does not exceed 1 Celsius degree. It is characterized of lobar pneumonia, enteric typhus, and viral infections, for example, flu. Wave-like fever is characterized by gradual increase in temperature and followed by gradual decrease in temperature with more or less prolonged period of normal temperature, which creates the impression of a wave-like pattern. The exact mechanism of this fever is unclear. It is often seen in brucellosis and lymphogranulomatosis. Hectic fever. It is exhausting fever. In the morning, the temperature is normal or even may be decreased, but the daily variations in temperature often reach 3 to 5 Celsius degrees and are often accompanied by exhausting profuse sweats. This fever is characteristic of active tuberculosis of lungs and of septic diseases. Irregular fever is manifested by alternation of different types of fever and is accompanied by different and irregular daily variations. It is seen in rheumatic fever, endocarditis, sepsis, tuberculosis. Cytokines may produce both local and distant action. The total effects produced by mediators may induce systemic inflammatory response syndrome. The main cytokines that stimulate development of systemic inflammatory response syndrome are interleukin 1, 6, and tumor necrosis factor, with interleukin 6 playing the dominating role. Systemic inflammatory response syndrome is an inflammatory state affecting the whole body. It is the body's response to an infectious or non-infectious insult. Although the definition of this syndrome refers to it as an inflammatory response, it actually has pro- and anti-inflammatory components. You see two kinds of this syndrome. Non-septic syndrome, which is not caused by infectious agents, and septic syndrome caused by infectious insults. Systemic inflammatory response syndrome may be suspected in existence of at least two of the given below signs. Please read them. Systemic inflammatory response syndrome develops in stages. It has stage-like character. In the first stage, there is local production of cytokines in response to injury or infection and local inflammation. In the second stage, small amounts of cytokines are released into the circulation, which recruit inflammatory cells and acute phase response development. These conditions are favorable for wound healing, elimination of pathogenic microorganisms, and for maintenance of homeostasis. The third stage begins when the amount of released cytokines is very high and this inflammatory cascade can no longer be controlled. This leads to generalized inflammatory response, loss of capillary integrity, stimulation of nitric oxide production, maldistribution of microvascular blood flow, and organ injury and dysfunction. Syndrome of inflammatory response makes the pathogenetic basis of multiple system organ failure. Multiple system organ failure is a consequence of the inability to maintain organ perfusion and oxygenation, resulting in injury and organ failure. This non-specific form of pathology develops in different critical conditions of an organism. By etiology, there are two kinds of multiple organ system failure. First is the failure that results from aggravation, from exacerbation of some pathology, and the second kind is iatrogenic multiple organ failure. Depending on the specific reason, this syndrome may be of infectious origin, which includes 90% of all multiple organ failures, of post-traumatic, post-hemorrhagic, post-burn, post-resuscitation, pancreatogenic, and iatrogenic origin. By mechanism, the following variants of multiple organ failures are distinguished. Primary multiple system organ failure, which develops in a result of direct action of the damaging factor of any etiology on an organism. For example, in multiple trauma, in severe burns. Here, the signs of dysfunction of organs appear very rapidly. Secondary multiple system organ failure develops after the latent phase and is the result of systemic inflammatory response syndrome. On the screen, you see the scale for evaluation of multiple organ failure. Here you see pathogenesis of multiple system organ failure. The starting point is damaging factor, which causes tissue injury. The pathogenesis consists of three phases. The first is induction phase, second phase of metabolic response, and the third is phase of secondary autoaggression. The first phase includes humoral component and neurohumoral component of systemic inflammatory response syndrome. The humoral component includes release of mediators of systemic inflammatory response syndrome and of compensatory adaptive response syndrome. These mediators are released into the bloodstream. Neurohumoral component consists in activation of the hypothalamo-pituitary-adrenal axis. Phase of metabolic response includes hypermetabolic syndrome and autocannibalism syndrome. Hypermetabolic syndrome consists in mobilization of energy resources and plastic substrates in order to counteract pathogenic agents and reduce the scale of damage. Autocannibalism syndrome consists in the shift to endogenous energy sources in order to save on the digestive tract. Inhibition of appetite, hydrolysis, and absorption in the intestine, decreased blood circulation in the intestine, structural changes in the brush border, including enterocyte apoptosis. The third phase of secondary autoaggression consists of manifestations of multiple system organ failure, including adult respiratory distress syndrome, hepatic failure, renal failure, secondary immune deficiency, DIC syndrome, encephalopathy, malabsorption syndrome, and intestinal autointoxication syndrome. Thank you for attention.